Mhm. All right, hello everybody. I'm so excited to be bringing this webinar to you in collaboration with Novartis. We're grateful for their collaboration to help make this possible. This is a conversation I've wanted to have for a really long time, and maybe you're watching this video because you're getting a new diagnosis or you're wanting to learn more about SMA or spinal muscular atrophy. Who is joining me today is Dr. Megan Crone.
Crone.
Now none of you will forget it, okay? I got nervous and I doubted myself. But just to walk you through this conversation that we're going to have, I'm coming at from a parent perspective in 2016, where when we got our news delivered that our child would have spinal muscular atrophy, there were no treatments, there was no cure, there was really no other options other than keeping our child as comfortable as possible. And now here we are in August 2023 with so much change the landscape. And I want to have this important conversation with a doctor who can provide some insight and answer some of those scientific questions, but help you understand them on a level that's consumable and that you can actually understand. Because sometimes when you're sitting or maybe getting a new diagnosis, there's so much information coming at you, you don't know how to distill it. So we're going to distill down some of those questions and then give you some tools that we hope will help you be successful in your journey as you navigate this and continue to live life to its fullest. So I'm going to let you introduce yourself. Thank you for taking time today. And why don't you tell us what you do, how you do it, and where you're based?
Sure. So yes, I'm Dr. Crone. I'm one of the pediatric neurologists here at the Alberta Children's Hospital. I'm one of two of the pediatric neuromuscular physicians here. I also do general neurology and neurocritical care here in Calgary, and was previously the pediatric neuromuscular physician in Saskatchewan for the last 5 years.
Wow.
So my role right now is Calgary and taking care of most of Southern Calgary, but I am in connection with other provinces as well to kind of help facilitate care for SMA patients in Western Canada.
Okay, amazing. So here's in our family, in 2016, there was no newborn screening. You had to wait until you were symptomatic or something went wrong or your child was failure to thrive and you start, uncovering all these layers. We're really excited because almost all of Canada is now screening for spinal muscular atrophy on newborn screening, which is that little heel poke. So a family comes in and now they get this news. Hi, your child has spinal muscular atrophy. Can you explain what SMA is and that conversation just to help people to the simplest form understand SMA?
Sure. So SMA or spinal muscular atrophy is a genetic condition that can affect children or adults at any age. There are 4 different types, with the most common one being type 1. And this is a condition that affects the gene SMN1, in which most will get 2 copies, one from mom and one from dad, and both of them will have changes in it, and that's when a child will present with the symptoms. What happens is SMN1 makes a protein called survival motor neuron, and that's what helps make sure the nerves in the spine and kind of the base of the brain that send the messages to the muscles work properly. So when you don't have that protein, those nerves start breaking down and the muscles don't get the message. And when the muscles don't get the message, they get smaller or they atrophy. So that's where the spinal muscular atrophy comes from. And with time, that atrophy gets worse and weakness gets worse. And it basically affects anywhere that there are muscles in the body. So mostly the arms, legs, the trunk, the breathing kind of muscles, but as well as kind of the muscles for kind of swallowing as well. And this is a progressive condition that can happen. And it depends on how old you are as to kind of how quickly and what kind of different skills you can achieve.
So we mentioned that there's newborn screening. So often sometimes anyone presenting a child, or it can even present itself in adult onset. And we're really talking about newly diagnosed as a baby here in 2023. And so we know that you're missing this gene that reproduces this protein to help you, utilize your muscles and that strength. When you're not utilizing them, they're atrophying. And so that can rob the body of movement. Examples being, walking, breathing, that muscle movement, eating.
Exactly.
So very basic skills can be robbed. However, a family now would get screened at birth, their child would get screened at birth. And now let's say they get that diagnosis. what would you give family as next steps for kind of here's the journey of what we see as next steps to set your child up for a healthy, full life because the landscape is so different?
Yeah, so kind of how this first starts now is after you get a positive newborn screen, you typically meet with a neurologist. It may be a general neurologist or a neuromuscular physician. And the first steps are just to let you know that it's a positive screen and that we have to do confirmation testing and to kind of do more detailed DNA testing to confirm that our screen was truly accurate. The likelihood of a false positive is, or a wrong test is low, but we still do check and confirm as well. And then you get to start meeting with the neuromuscular physician once it's confirmed on that genetic testing about what SMA looks like. And then you start meeting with our team. And we have, and lots of other centers have, a number of people on the medical care team. This includes nurses who are specialized in neuromuscular medicine, specialized neurologists in pediatric neuromuscular medicine, often pediatricians, breathing doctors, and then so respirologists or physiotherapists, occupational therapists, sometimes speech language pathologists, social work, and either orthopedic surgeons, sometimes too, depending on the center you're at. So it can be a very involved team, but that's also shouldn't be scary either, because when we're meeting you with a newborn screen, your child won't have symptoms. And so it seems a little bit intimidating to hear such a big team is going to be needed for your child who looks perfectly healthy. And that's the goal, is we want to make sure that we're just being anticipatory in your care and having all the right people ready, but hopefully you won't be needing all of them. The next step after that is we will do some blood tests to check to make sure that your baby's body doesn't have kind of a certain antibody. So that's how your immune system fights off certain things, because that's part of some of the treatments that we can use nowadays. There are 3 different treatments now available for spinal muscular atrophy, which wasn't the case 5 years ago. So it's a very different kind of landscape, as you've said. And so those are kind of the options that we would be discussing. I don't know, would you like me to go into the different drugs right
Yeah,
now?
let's dive into it. I think that's
Sure.
great. I mean, we talked about this before the call. So one of the questions or the conversation that we had with Dr. Crone was saying, in 2016, we were presented with 0 options. We were trying to get clinical trials, and the incredible and amazing news that we celebrate now is that there's not 1, there's not 2, but there's 3 treatment options. So I would love if you could share the 3 different treatment options. And again, we're not prescribing anything for any children. This is not medical advice. I'd like to make that abundantly clear. This is I'm doubting myself. So now I'm like trying to Crone.
Yes.
This is so stressful for me. But we're asking Dr. Crone not to provide medical advice, but just to present the 3 different options and how they work and then how they help. And again, you can take this video. This is just some basic high-level information for you, and then you go and meet with your medical team. But I was really excited right when our son was, diagnosed with this. Spinraza was in clinical trials. Now there's Zolgensma and there's Risdiplam, and it's incredible to see the landscape. And I will say we're seeing kids downhill ski, take ballet classes, run and jump and skip. And so it's incredible to see what happens when children access treatment. So can you share the treatment options with us?
Yeah, so you've mentioned the 3 of them. So there is Spinraza, also known as nusinersen. There is Risdiplam, also known as Everdecy, and then there's Zolgensma, and that's the gene therapy. And I personally can't even pronounce the full name of that one, so we all call it Zolgensma.
They really like making drug names very complex, which I find
do.
confusing.
Yeah, so they like to put you on the spot, and like you're supposed to be able to kind of pronounce this like tongue twister at the same time. So, but those are the 3 medications. So nusinersen and Risdiplam, those are 2 medications that work towards changing what's called SMN2. So that's the backup gene to SMN1, which was the one that was impacted and caused spinal muscular atrophy. And so what it's doing by kind of changing SMN2, changing SMN2 allows to kind of increase more of that protein, that survival motor neuron protein. So by having more of that protein in the body, it helps support those nerves. So you're going to have less of that muscle atrophy. And the goal with those drugs are to prevent further weakness from happening. And a lot of children actually see some gains happening on the drug as well. So Spinraza, which was the first one that came through in Canada, this one is done what's called through a spinal tap. And so this is below the spinal cord with through a little needle that we infuse in around the fluid around the spinal cord. Children are asleep for this, so it's not uncomfortable for them while it's happening. It's done really